You're ready.
Good afternoon, everybody. This is April 25th, 2024, Jefferson County Health Department Board of Trustees meeting. It is 4 p.m. I'm going to call this meeting to order. Roll call, Ms. Pinkley.
Mr. Pig,
I'm here.
Dr. Henry,
Here.
Ms. Stidham,
Here.
Mr. Deal,
Yes.
and Ms. Davis.
Quorum has been established. Dr. Henry, would you please read the mission, vision, and purpose?
JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County. The purpose of the health center is that JCHD is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much. Motion to approve the agenda as presented.
So moved. I'll second.
First and second, any discussion on the matter? Not hearing any, all in favor, please say aye. Any opposed? Motion carries. We have one guest from the audience, Ms. Downer. That's all the comments further down. Approval of the minutes and expenditures, looking for a motion to approve the March 28th, 2024 meeting minutes.
Make a motion that is for the minutes. March 28th, 2024.
First, or a second?
Second.
Have the first and second, is there any discussion on the matter?
Can I ask? Some of the words are underlined, is that just copying? Or,
I think it's the watermark,
Right.
the draft watermark on it.
oh, okay, I'm sorry, I didn't see that. Okay.
All right, any other further comments? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Approval of the April 5th, 2024 special meeting minutes.
Make a motion that we approve the minutes from April 5th, 2024.
Have a second?
Yeah.
First and second, any discussion on the matter? Not hearing any, all in favor, please say aye. Any opposed? Motion carried. $175,605.29. Do I have a motion?
I move to approve the payment of the March expenditures in that amount.
Second?
I second.
First and second, any discussion on the matter?
Yes, please.
Yes, ma'am.
I have a question about the birth control supplies. Back further in the agenda, there was a statement, I don't know exactly where it was, under Title X, where we received $20,000 that was to be spent by March 30th. But I don't see that amount. I only see where it comes up to $9,254 for birth control supplies that are listed here. So I'd like to, if we had $20,000, and I can find it in here if you give me a second, to spend by March 30th, where did that go? Did we spend the full 20 or did we not? I only see about 993 spent on those things. Let me find that out. Look on the slides.
It is in the.
Under
capital
the family
report.
planning,
Yeah.
it
So Title
says,
10, usually at the end of the contract year, they provide additional funding to us based on their budget and availability. So it wasn't only contraception. So if you look at the statement, the funds were utilized for contraception, period, and hygiene products. Educational materials, literature, posters for the clinic. So it was, it won't be all in the single line item for the contraceptives.
okay, so where do we have that extra money? Where would it be? is it in some kind of like printing materials, or is it itemized out like that? So we could just see that that full tone was spent on the Birkenville stuff.
I'll have to get with Kristen. with
Yeah,
that.
probably all of the invoices haven't come in yet, so we.
Okay.
We incurred the expenditure. so-
Okay. Okay. All right. That's all I have.
Yes, ma'am.
Then, March 27th, there's notation for birth control supplies for family funding clinic. Is that what you're talking about?
Yeah, for the
The
7580.
$7.
And then there was another one for 1600. On 3/7 for birth control supply, became, I mean, there was 1674 there. And that was all that I found for birth control supplies, or family. That's all.
Is there any other remarks, questions? This is the approval of the March 2024 expenditures for $175,605.29. All in favor, please say aye. Aye. Any opposed? Motion carries. Next is approval of the March 2024 electronic payments for $280,924.15. Take a motion, please.
Make a motion. I'll second.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next is pre-approval of the May 2024 electronic payments for $602,804.08. I will motion.
I'll motion to approve the expenditures for electronic payments for March.
I'll second.
Having a first and a second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next is the public health report, Mr. Sykes.
Don't have a whole lot. One thing I wanted to do, we did have a employee professional development day on 21st. I think it was very successful, and I just want to acknowledge, I know Brianne and Nikki did a lot of work putting that together. Mr. Tim Pig came and talked to the group as well, but I think we had a pretty good meeting that day, a lot of good speakers, a lot of good topics. I want to remind the board that we've activated our internal emergency operations due to the measles that we are seeing, uptake in measles across the country. Although we're not seeing any in our county, we just use that as an awareness. And what that does is allows us to do more training and just make sure we're prepared. And so that's going on right now within our office. And basically what they do, our preparedness team looks at our plans to see what we have, not just for measles, but for any type of emergency might come through our county and how we would react to that. And this gives us an opportunity to exercise that plan to see if it's going to hold up or if there's some gaps in the plan that's going on. So we will be exercising the plan on the 30th, Tuesday the 30th. Some ongoing projects, strategic planning. We are going to look, I think it's May 1st. Several of the admin staff will be meeting to put our strategic plan together. We did a strategic roadmap. I think some of the board was involved with that. It's been a while back. God, how long ago that was. Work through our strategic plan and present that to the board. We are still working on the job descriptions with HR solutions, right? No, Taylor May. That was very good. They're working through that. A lot of different job descriptions. We're trying to get a similar look, to our job descriptions. And taking a lot of staff time, but, hopefully, I don't know if we have an end date yet on that, but, is she, they,
I mean, we're shooting for the end of June to be completed with that and the comp study.
yeah, and then the salary study, we met with them just 2 days ago, and they've given us a lot to review. They have not given us any salaries. They have just given us other companies that they've looked at and what their job descriptions were, so that we could see if they're, how closely related they are to our descriptions. But there's no salary for us to look at and say, well, that one's too high, so, or that one's too low, we're not gonna worry about that. It's basically just, it's off of what the job descriptions. And if we say, yes, this one looks like very close to what we do, then they'll choose that one or two of them to say, here's the salary range. So I thought that was a pretty good, a fair way of doing that. The other thing, this year, July 4th is a Thursday, July 5th being on a Friday. We've elected to go ahead and close the office on that day. We have a skeletal crew because we have very limited clientele coming in on Fridays. So we felt like it'd be a better use of our time and to have staff work Monday, Tuesday, and Wednesday, and be closed for the holiday, and then on Friday. So that's the
Wouldn't
plan.
be any cost, right?
Would be no cost because they would be working Monday through Wednesday. And we'd like to go ahead and get that and put that out now so that the community would know that we should close July 4th and 5th. That's really all I have for mine.
I do want to back up and ask a question. So, strategic plan. We're going to present that to the board. Let's work on that date. Make sure we try and keep as much of, keep it as well, you know, make it an easier, lighter board meeting as we can.
Okay.
Anything else? Do you have something else you wanted to?
Not this time. I'll,
Okay.
yeah,
Could I just so folks are aware, could I mention that Steve Crawford received a Lifetime Achievement Award from the Missouri Environmental Health Association, so congratulations to him.
Go ahead.
I put it on the agenda under new business. We can go ahead.
I'm sorry.
I wanted to be on the agenda, but if you're all right, we want to go ahead and. I'd like to read the.
It's out of the.
That's all right. I'd like to read the actual write-up that they had for Steve. This is the Missouri Environmental Health Association Lifetime Achievement Award. And where's my piece of paper about the award? It's the most prestigious award that that group gives out. Graduated in 1998 from Drury College, Steve Crawford began his career as an environmental public health specialist with the Franklin County Health Department. Shortly after, he moved to Miller County Health Department before finding his way to Jefferson County Health Department in 2001. Since then, Steve has made invaluable contributions to the growth and success of the Jefferson County Health Department. He developed and expanded the vector control program, acting as a resource for other health departments and local governments on mosquito control and surveillance activities. He soon gained his certified public operator's license through the Missouri Department of Agriculture and later became an instructor for this course. Steve transitioned from environmental into an administrative role for the health department in 2017 as the satellite facility supervisor, where he was then promoted to his current role of operations manager in 2021. As operations manager, Steve manages custodial staff, the JCHD fleet of vehicles, including the larger vans, for the dental and wellness programs. And he manages the facility maintenance at the 2 JCHD locations. Steve served as a board member and committee chairman of the Missouri Milk, Food, and Environmental Health Association for many years, including a stint as president from 2007 through 2008. He developed and maintained the Milk and Food website, and created the first online conference registration form for that association. Reprising his role of board advisor and mentor several times throughout his tenure, Steve has shared a wealth of organizational and knowledge and guidance of governing Robert's Rules of Order. He is professional and courteous, offering different viewpoints to spark meaningful debate and lasting relationships. Over the years, Steve has been recognized for his outstanding service in both the field of environmental health and Missouri Environmental Health Association. He was awarded the Missouri Society of Professional Sanitarians Rookie Sanitarian of the Year way back in 1999. He became a NEHA registered environmental health specialist in 2007, which is not an easy thing to do. It's a very difficult test to take and pass. And he was the Missouri Milk Food Environmental Health Association's President's Award, awarded that award on several occasions. Steve was the driving force behind the Missouri Environmental Health Association and the Missouri Milk and Food Environmental Health Association merger. So we had two groups in the state, and we combined them, and Steve was the one who really pushed that. Being well versed in the history of both organizations, he understood the importance of joining together to ensure a strong future for all. Steve's hard work and attention to detail is unmatched. He has spent countless hours reviewing bylaws and communicating with attorneys, while also keeping the membership apprised of the progress, ensuring each step of the process was performed correctly. Steve is a well-respected member of the Missouri Environmental Health Association, and his years of dedication has been instrumental in the overall success of his organization. His passion for food safety and environmental health is evident in all that he does. And they said it's an honor for him to have. And this is the plaque that they presented Steve for his lifetime achievement. So. So maybe later we'll get a picture with George if you want to.
Well, I ran out of ink, so I'm gonna do now.
All right.
But I do have questions on all of that. I wonder about it. Steve's report. Oh, the director's report. Yeah, I just have a couple of questions. Can I go in?
Yeah.
All right, so let's go to this increase in measles. There, as of 2 days ago, because we're stating, and in here it says that we are doing activation, or the Public Health Emergency Operations Center has been activated at the awareness level. This activation is due to a substantial increase in measles cases. So my question is, as of yesterday, 2 days ago, it was 125. And I know we talked about that back in 2000, that it was eradicated. And what that means is if you go and look, there are still cases documented for 2000. And I don't know by what standards that you can label it as eradicated. But to the research I found, it's 12 months without a reported documented case. But there are still in 1999, 2000, 2001, there are still documented cases. My question is, we have 125 cases in the entire country. 73 of those have been documented in an illegal or immigrant or illegal camp in Chicago. 63 of them in a migrant camp that's been documented. So we still didn't have half of the number. I think it's excessive that you're going to this extreme, considering what is stated in this emergency preparedness And under the mission, it says, we will issue and enforce public health orders. Yes, it's in here. So. If we're still looking back at 2020, 2019, 2020 of the emergency preparedness, which we're still working on according to this here, that the final submission is due August of 2024. So by August of 2024, we should wrap up how we evaluated the preparedness. So this measles preparedness, I'm very concerned that we're heading down another path that happened when I was here of enforcing and trying to enforce public health orders. And I'll be the first one to really stand up for the constitutional right and medical freedom of this community. That's why I was elected. That's the main reason why I was elected last year.
I don't think we made that declaration. That declaration was not made from us. That was made from the emergency management, right?
Of the original.
For the measles.
Oh, no, this is just, the FIOC is just our internal, and it's just an awareness level. And we're just practicing our plans here.
But it specifically says measles, that's why we're doing it, because it says
Because, yeah, and that's what, because it's there, and so we're practicing based on,
measles is always been here.
but it's not, we're not saying that it's here, and that's why.
So this is
we're
the
doing it.
tabletop exercise.
Yeah.
You're talking about a tabletop exercise.
No, that's what's written.
No, it's a tabletop exercise.
But
What's that?
It is training. It's a training exercise that is done by the EMA or emergency management. It's to test the system, what they do in the response to it.
And we haven't done that since, when was the last time we've done it?
So we have not done a full scale exercise since 2019. So part of one of my grant deliverables is every 5 years, we will do a full scale exercise with Metro St. Louis.
So everybody can hear you.
Yeah, and my main concern, and I'm not from the side,
Yes, oh yeah.
people are, we're gonna have.
This is a
hearing in the
training,
county
this is a
that we
training,
try to
right, this is a
Yeah.
tabletop training.
So a couple things. So going back to measles eradication, that is looking at locally transmitted measles. So there is measles in the United States that's coming in from other countries, but we've not had locally transmitted to where it is going through our community person to person. So that's where that eradication comes through. Yes, we've always had cases, but we were not continuing to transmit throughout the community. So that's the difference that we're looking at now is we have local transmission between people.
Where,
Um,
and there's seven documented places, seven.
so
And half of it is in a shelter of illegal people that have come here that probably are not vaccinated.
I don't.
So
have the
that's my
specifics on
point.
it.
Half of these cases are, look, like seven, almost all of them are very specifically like, and it's three or more. It's not like a whole community. It's, or
Right.
maybe it's two or
So
more.
Chicago's not far from us, Indiana, it's popping up everywhere. We do follow communicable disease every single day. This process we do every day for all kinds of stuff. The activation of our internal EOC is to practice, and this is a perfect opportunity really for us to practice internally. So my communicable disease team, they investigate, they educate every single day. But we don't always pull in the testing team, the community clinic team, the vaccination piece, if we need additional staff to come in to make phone calls for education. That's really what we're practicing at that tabletop exercise. So what it is, it's a short scenario of what it looks like for the communicable disease team to get a case, for them to realize it's gonna overwhelm them and they don't have enough resources to get through everything. So if we look at however we feel about vaccination, the best case vaccination for folks that are exposed is within 72 hours. Helps prevent that disease from continuing. That's a very short time frame in our world.
So we're recommending vaccination after you.
We are
contracted the
recommending
disease.
what this, no, for those that are exposed.
Exposed.
Yeah, so if I had it and I exposed Jetty, if she wasn't vaccinated and she wanted to be within 72 hours, that would be her greatest protection against not getting sick. The CDC is, well, we will always follow their guidelines. So at this point, there's no quarantine, there's no mandatory isolation. They have guidance where they recommend vaccination. They do not mandate it. Our job is to make sure people have the education, and what the CDC recommends. And that we're here then to follow up if they do want to be vaccinated, or if they need testing, that our staff are ready to do that in a very short time frame, under 72 hours. The next tabletop we'll have will be for Hep A. If we had a Hep A outbreak with a food facility involved, which 2019 Franklin County had 3. It's a massive, massive wear on resources and people, because we would be offering a vaccination for anybody that ate at a facility for a month or 2. So a huge population. So this is kind of our stepping stone into that next bigger one. And it's part of our deliverables that we practice.
So it is a training. Did you get the opportunity to read the invite?
I emailed.
Yeah.
And that's what that
Okay.
that email is about, is because I specifically wanted you guys to go to it so you could get the experience of what it's really about, what's going on. And it's purely a training exercise.
Right, and I'm all about being prepared.
Mhm.
But if this happened in 5 years, in 2009, up from 2000 till now, so 24 years, the highest case of measles in the entire country was 1,200. What did we do in 2019 to prepare for that? What happened in
So we
2000?
prepare for everything. Right now, measles is just the word we added to the tabletop. We could put anything in front of that tabletop. But we're constantly
Because
practicing.
I don't see it as a threat, I
Well,
guess, so my point being, like.
One second, I'll get you down every 1 second. I just want to tell you that, so if you put flu, COVID, Hep A, it doesn't matter what the tabletop sign is there. It's the action of doing and going through the process. I know that measles is kind of there, but this is just the topic that they chose. Yes, Valerie, please.
I am fully, and I think importance in infection control is to be public health. You can throw anything under infectious disease transmission. That almost the kitchen sink in me. I work at a school. I deal with kids who have special needs. Since I can remember getting vaccinated here 50+ years ago. So we're saving some of, by past immunization for people getting measles. You still have to be vaccinated for school. So some are getting vaccinations unless there's parents who don't want vaccination. Are they still allowed in the school system, even if they don't get vaccinated for measles, mumps, and what have you?
Jefferson County has a really high vaccination rate in our schools. So our kindergarten rate is almost 93%, which is higher than the Missouri national average. But they still 95% is what they look at for that.
So
herd
basically,
immunity. So
that's
we're
why we're
just shy
not
of that.
seeing the uptick.
Yeah.
Right now, but we could see later on down the road, so pray for any infectious disease problem could be. But if you just add infectious disease, leave out measles.
Yeah, it should happen to me, it'll be Hep A the next time, because we're already planning for that one, because it pulls in our environmental staff as well. So the tabletop is really to exercise the communication between each department, and how smoothly it can go, because measles is very fast moving. Hep A is gonna be a little bit slower, so we'll have more time. We won't necessarily have to call people in on the weekend. But if this came in on a Friday afternoon and we needed to offer vaccine or testing for folks over the weekend, we need to make sure that all of our staff are prepared for that and they know how they're gonna get that call to say, hey, we need folks to come in. Because we don't want to be in a spot where we've got folks that need our services and we fell down and didn't have staff to come in and we didn't have a process in place. So that's the true part of the exercise, is looking at that process.
And I would encourage both of you to really go, because it's quite educational. And again, regardless of what they're attacking or they're training on it, it's the process. So,
Well, and what really sparked my interest is if we're gonna issue and enforce public health orders, like. Are we going against the Constitution to do that like last time, or where
With
where
that
are
in
we
mind,
standing?
Did I have that written down in mine?
That's under some mission statement under public health awareness, I can find.
I will say for measles specifically at this point, there's no isolation or quarantine even listed on CDC's recommendation. We are really, our job is to educate and to let folks know what that disease or illness means for them and how they could transmit it. And then it's up to them to make that decision.
As long as we're given the right information about the vaccine. I don't know where it's at. It's under the mission statement. It's in one of these bottom sections. I don't know.
Okay, I'll look through it and see.
Yeah, because it does say, and that was my main concern, was this preparedness. I'm all about being prepared and ready for crisis, but if we're gonna start, we're preparing to start issuing and enforcing public health orders. Who's planning on doing that?
Okay.
Yeah, it's under the public health preparedness
Yep.
section, mission capacity to promote ongoing community resilience and preparedness, issue and enforce public health orders, share information with key partners and the general public, and lead the health and medical response to emergencies.
And that is from the Missouri Foundation model. When we were using the Missouri Foundational Public Health model.
Are we still using that? Because I can't get on board
State of
with that.
Missouri, the state of Missouri is the lead on it, so
Yeah,
we really just.
Do we always have to follow everything they say legally?
It's in,
It's where's that document?
it's
It's in the DHSS regulations,
I'm
Do
sorry.
what I'm saying?
the DHS regulations
Do we have to follow
we-
everything they say?
that we have to adopt it. And keep in mind, public health orders, a lot of things can fall under the umbrella of public health orders. You're just say, well, we're talking about quarantine isolation, those can be types of public health orders, but that's not the only types that there are. Like, for example, a public health order could simply state, we recommend the vaccination as if somebody has been exposed to measles.
And I'm okay with recommendations mandating, enforcing people to do things against their medical.
I understand 100%.
Right, and I don't know where you were, this woman with, when the orders went out during COVID. But we just want to make sure that people know that I am all about making sure we stay within the realm of the Constitution, which is more important than an order from Missouri, the Missouri Division of Services.
Can I ask you,
Yes.
are procedures for the case of infectious tuberculosis who may be non-compliant and who may or may not have exposed other people can result in orders to isolate or quarantine people, so.
Order from here, the state? Who gives those orders?
It's the state statutes and CD is separate from the rest of.
But it's not the law.
It-
And I'm
Are you-
speaking on the medical freedom. Regardless of what it is, it's medical freedom. If you
So
want to
you're opposed to that?
mandating people to stay home, so we put them in jail if they don't stay home? No, I'm not okay.
We can't put people in jail. But we can't put people in jail. What we would have to do, and this is what we would have to do whenever the COVID orders are issued also, is that we would have to go and file a complaint in state court across the street and ask the court to hold them in contempt, at which point the sheriff's office would have to go pick them up and put them in jail. We can't put people in jail.
Right.
And we
So it would
did
be,
not
so
do
we
that.
could do all that, but then it would be the sheriff. And from what I understand, in his comments, he would not be putting people in jail for it.
And that is not something that.
I'm gonna pull us back to other things, because this is getting way off the trail of where we need to be, is getting tall weeds. There's a lot of different opinion. I don't think anybody has a right to affect anybody else with the community disease. Say that right from God and everybody. You don't have a right to go out and infect somebody if you have a community disease. That's my stance on it. You know, everybody might think they have that right, but you don't. Stay home if you're sick. You can't stay home on your own, and sometimes you need help. Is there any other questions you had? Anybody else have any other questions? I'm sorry.
Thank you.
Yes. Yes, ma'am. Anybody else have any questions, other questions for Mr. Sykes? All right. Not hearing any, let's move on. The next is public comments. I believe we have one person that signed up for it. Hold on 1 second, please. Okay, please be civil, Ms. Downer. Let's, well, I say it to everybody every time. Civility is the key word, no personal attacks. And when you're ready, please give your name and address and subject matter you're gonna talk on, and we'll start the timer.
Okay.
Right.
Hello.
All right.
I'm Liz Downer from High Ridge. Just to add to this little conversation we've just had, there is a resolution on the table that was voted on by this board in January 27th. When was that, 2022? Concerning communicable diseases, and I would request, as others have in this county, are concerned about this resolution, and I would like it to be opened up for discussion again by the new board, and probably we need to rescind it after the conversation that we just had. I don't think it's necessary to actually have this resolution out there. That's one thing. The others are kind of my request to receive documentation from the health department or from the board, are county records that I had asked for the 2019 and the 2020 audits to be added to the website. It kind of like stops at 2021. Also, we have never publicly been given, the Jefferson County residents, taxpayers have never been given the information regarding COVID money, whether how much our county took in, what federal funds we received, what Missouri funds we received, any funds that we received from any organizations, and the breakdown of how all of those funds were spent. If there were any funds left over, were they sent back? Were they allocated somewhere else? COVID testing, vaccinations, treatments, advertising, whatever the funds we received and what they were used for. So I think the Jefferson County taxpayers are asking for that. We just want complete transparency regarding the COVID-19 funds. And those can just be posted on the website. That would be fine with me. And then the other things I was looking for the original bylaws. Because I know the board was established in the early 1950s. But I did not see a bylaws when I was last doing my research. And so I was looking for the records from like 1964 to 1985 is what I requested. And I just want to look at it. I don't need copies of anything. I just want to look at them, and I want to be charged for the time that I'm supervised. And I don't want to be charged for copies of everything. Because it's getting pretty expensive. I think I'm up to like $200 or something that I'm being told that I have to pay for documents that belong to Jefferson County taxpayers. And I yield.
Oh, okay. Okay.
May I be added?
Sure.
Okay.
Need to sign in, please.
Yes, I'm sorry, I got here late in traffic. Sorry about that.
Traffic was real bad down.
Yeah, school traffic.
One.
I just want all of you to know, there's a group of 10 to 12 women that pray every Thursday for the health department. And we hope that there is a unity with everyone, and I heard that Steve Crawford was known, one of the things is debating. And in the past, I haven't been to too many meetings, but I've noticed that sometimes there seems to be debate and it gets a little awkward. And actually, we had one at our prayer meeting. And so I said, well, I'm gonna have the prayer meeting. We're not gonna fight. And so that's the job of the leader here, Mr. Pink. So, but anyway, I just hope that you all can communicate things that you've researched, and some people love research, some people love facts, some people love their experiences. And as far as when somebody's found out they're sick, if I've been on the job, I said to somebody, I don't feel good. And somebody came to me, you're going to the nurse department, you're gonna go home if you have a fever. So I got sent home and I thought I was good enough to work. So how do we determine if somebody's sick? Parents should be willing to keep their kids home if they're sick. And I know some that send their kids to school sick. They find out they have something that's contagious, they get sent home. And so parents should plan ahead for that. As far as mandates and, what I understand is by law, you have to follow CDC guidelines. It's not something that it's an option because you get funds. So you have to follow the guidelines is what I'm understanding. That is the law. Am I correct? That it is the law. You have to do this. And then who enforces? The police, if you have to go to court. But it should be up to the doctor to say, look, you didn't have your vaccine. We want to offer it. And my kids all had them. But the thing is, we do need to learn there are some people that have bad effects. I have a girl in the hospital right now at our church. She had the vaccine. She had several boosters. The doctor said, I'm so sorry, we can't give you any more boosters. You are having major health issues because of it. So the doctors should be in good communication with you, how they're dealing with their patients. And patients and doctors should make the plan of how things should go in their lives. So the only time you have to get involved if there's an outbreak and somebody is being out there and causing somebody to be sick. I was in Walmart next to somebody coughing and sneezing. I could tell they looked like they had a fever. I wanted to tell them, go home. And so most of us probably got COVID out in the public place. And so it was a lot of fear. There was a whole lot of fear during that time because it was unknown. We shut down our church. We know a man that sued the county, kept his church open, and he grew to 75 more people, had to move some to another church. I followed the guidelines and we had church. My husband and I did on Facebook Live. But I just want to encourage you to work together, be willing to debate. Take a little time, have some time to say, hey, I got some facts here and someone else has some experiences. Put it all together and see how the community can learn. That's where we want to see trust in the community, that everybody here is working together in unity, not I'm right and you're wrong. And that's what we run into when we're passionate about something. I'm passionate. We got a bunch of old people in our church. I'm in my 70s. They're all getting sick and dying. Praise God, they're gonna be in heaven. Hope you all know you're gonna be there. But it's a matter of what we're passionate about. I mean, I'd like to preach to all of you to know Jesus, but we want to pray that everything goes smooth here. And that nobody has to have a policeman come to their door and say, you've been bad, you're going to jail. That's the fear people have. There's people in our church that are worried that they're going to have somebody come to their door and make them go to jail. And we don't want that to happen. How many people have you had to put in jail over this whole thing during COVID? So we want to trust that that's never going to happen. And that's the fear a lot of people have. And I used to minister in prisons. We had to have a TB test every year because there was an outbreak in the prison. And so we had to have that test done. And so therefore, we complied. But when it came to some of these vaccinations are really hurting a lot of people because their bodies aren't accepting certain vaccines. And that's where doctors need knowledge of the risks. You know, my husband's a diabetic and he has high cholesterol. And so the doctor says, here you are the risks worse than the benefits? And we say, we don't want this one. So they worked with my husband until they found a combination that works for him. So.
I'm sorry, you did, you didn't tell us your name and address.
I'm sorry.
That's all right.
I'm Penny Waddle, 5180 Schumacher Road, High Ridge, Missouri.
Thank you. I didn't want to interrupt you.
I'm
Started right in
sorry.
here, so no, I didn't interrupt. Thank you very much.
Myself.
Thank you.
you.
All right.
Thank you.
So next on our agenda is New building updates. Crawford, you'll see. Oh, sorry. One Steve, I'm sorry, I apologize. Mr. Sykes.
So I put this out before we had our meeting today, but the packet went out earlier this week. We had our last meeting this morning. They are pouring footings, and you actually can go and drive and actually see the footing. Just don't get down into, drive down into the site. You may get ran over by some heavy equipment. But yeah, the footings are being poured, things are starting to move along. I misspoke here and put that we were waiting on a permit. We do have our permits. We're good to go there. We're having a furniture meeting on the 30th. Pick out furniture.
When was that?
Yeah, supposed to be there.
I've been to the real in bed. Was it that again?
Full day with this like a.
Oh, boy, here I
Day is the
When is it?
30th, Tuesday. After,
Make sure you send out an invite.
He did.
Okay.
I just haven't kept up with any of my,
and then,
That'll be addressed shortly, I think.
so yeah, we'll get moving on the furniture. And then I've attached the financial reports, you know, that on that. The new time schedule, if everything goes perfectly, we're looking maybe the end of February with our final walkthrough, but I know we're gonna have some weather delays here and there, so I think we can say in the spring maybe that we should be in our building. If everything moves along, so there's still a lot of rock to be moved, but not near as much. They've moved quite a bit. And so it's starting to look like a building site now. That's all I had on that.
All righty. We have a need for closed session.
Yes, you asked for one, if I could address.
All right, somebody want to make a motion to go into closed session?
I mean, if I were any closed sessions.
Pursuant to 610.021, section 1, any confidential or privileged communication between the board of trustees and Jefferson County Health Department, our representatives, and its attorneys. 610.021, hiring, firing, disciplining, or promoting of particular employees by a public governmental body when personal information about the employees discussed are recorded, and as well as records that which are protected from disclosure by law. So we have a first and second. Is there any discussion on that motion? Hearing any roll call, please.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Here.
Mr.
Yes.
Taylor.
Yeah.
Mr. Duke, Ms. Taylor.
Yes.
All right. Motion carries. We're now moving into closed session. Thank you all. We shall